In the previous tutorials, we entered an appointment for a new patient and the patient's details. In this tutorial, we will review the dental record screen, which is one of the most important screens of Visual Dentist, and the screen that the user will spend in it the most time. We will also review the process of taking an X-ray and how the database of the dental practice management software, in this case Visual Dentist, should interact with the database of the X-ray machine. One of the first activities that the dentist will engage in for a new patient is taking an X-ray, more specifically a panoramic X-ray. Here we see a setup where the X-ray machine operates independently of Visual Dentist. As a result, the user needed to enter the information of new patient Tim Flag separately in the Visual Dentist database and the X-ray database. There is the obvious overhead of having to enter the same information twice, the danger of making a mistake when entering the data, the extra overhead of maintaining the information in both databases, and the overhead and possible mistakes of searching the two databases to find the same patient. Such a setup is simply not acceptable, and we cannot overemphasize this. Whether you decide to use Visual Dentist as your dental practice management software or some other software package, please make sure that the dental practice management software that you will use communicates with the X-ray machine and the X-ray machine database. In such a case, you will need to enter the patient information only once in the dental practice management software, that is Visual Dentist, and it is up to the Visual Dentist software to communicate with the X-ray database and update the X-ray database accordingly. Here we have the X-ray database on the same network as the Visual Dentist database. We need to consider two cases. The case where the patient has no X-rays stored in the X-ray database, and the case where the patient has X-rays stored in the X-ray database. In both cases, the Visual Dentist software will invoke the X-ray software automatically. If no X-rays are stored in the X-ray database for the specific patient, Tim Flag, the Visual Dentist software will create a new patient entry in the X-ray database automatically and will copy the relevant patient data. The data copied will depend largely on the specific X-ray database, but it usually includes a patient ID, the patient's first name, last name, and maybe the date of birth. In the second case, where the patient has X-rays stored in the X-ray database, the Visual Dentist software will locate automatically the specific patient in the X-ray database and will open the X-ray database at the specific patient, in this case Tim Flag, with the X-ray software ready to take additional X-rays for the specific patient. We will now have a quick look at the dental record screen. Click on Appointments. Click to the left of the patient appointment. Click on Dental Record. The first time we open the dental record for a patient, the user is asked to enter the patient's arch. We'll choose Permanent. The top area contains information that relates to the patient. From left to right, we have patient ID, last name, first name, contact telephone number, any medical history indicated in red, any notes for our attention, any general notes, And on the top right, we have the name of the treating dentist and the balance of the patient, which is the money that the patient owes for treatment that the patient has received. On the right, we have various buttons associated with specific functionality. The simplest button to explain is the one labeled Extraction. Click on button Extraction and select to remove teeth 25 and 26. The graphical representation is indicated in the area shown. Recording of the work done is indicated in the area shown. On the bottom, we have several buttons that takes the user to other screens or shows other views. From left to right, we have the Current Status button, which shows a graphical representation of the teeth today, as indicated here. The Initial Status is a graphical representation of the patient's teeth when the patient first visited the dentist. If we click on Initial Status, the perimeter becomes yellow. To go back to Current Status, click on Current Status. The New Treatment button enables the user to create patient treatment plans. Full Details takes the user to the patient contact details and medical history. Renew Appointment is used to set a future appointment. Lab takes the user to the lab work for the specific patient. Dental History shows all the dental work done on the specific patient. Payment is used to enter a single payment. Payments All shows all payments that the patient has made so far and can also be used to enter patient payments.